Good afternoon, everyone. Welcome to today's virtual roundtable presented by Dr. Stephen Beeson. I'm Matt Hoffman from Practicing Excellence, and I will be your MC today. Let's go through some housekeeping items to kick things off. We have a large group today, so everyone will be muted. We still do want to hear from you, though, through the chat function inside of Zoom. And actually, let's try that out right now. If you all could put in Zoom where you're dialing in from today. We can get some chat going. We will also have 4 polls during the course of the roundtable. Your responses will be fully anonymous, and we will share the poll results with you after the session. If you'd like to submit a question for Steve to answer, please use the Q&A function inside of Zoom, which is different from the chat function. And I'll be pulling questions from here at the end of the session during the Q&A part. Finally, you can find your audio settings at the bottom left-hand side of the screen. One quick note here, we're going to use the word clinicians a lot today. Our definition of clinicians may be a little different than yours. It includes physicians, nurse practitioners, PAs, RNs, LVNs, LPNs, physical therapists, techs, basically the whole care team. So I just want to be clear on that before we kick off. We are really excited that you're here. And if you're like most healthcare leaders we speak to, time is in really short supply. So a lot of gratitude for you being here today. And it really does mean something. Our mission at Practicing Excellence is simple: to help all clinicians thrive. We do this by identifying the top issues facing clinicians, leaders, and teams within health systems and medical groups. We then source faculty who are expert in solving these issues and distill their evidence-based wisdom into 5-minute video-based coaching tips. We then use a mobile app to deliver 1 coaching tip per week to all care team members. And then we run a proven process that inspires and engages clinicians. So everyone is learning and improving together at just 5 minutes a week. We partner with health systems and medical groups of all shapes and sizes across the country, and they all use coordinated skill building and our playbook for engaging clinicians to help achieve some of their most important strategic objectives. And we learn a ton from our partners about what works, what doesn't, and what kinds of content they need to develop their teams. Many of our partners are very focused on making progress in areas like patient connection, leadership development, and well-being, even in this era of exhaustion. Now, it's my pleasure to introduce Dr. Stephen Beeson. As many of you know, he is founder of Practicing Excellence. I will have him tell his story, but after dedicating 20+ years to developing physicians, APPs, nurses, teams, leaders through speaking engagements and one-to-one coaching, scale and reach became a prohibitive challenge. After writing 2 best-selling books on leader and clinician development and flying all around the country, speaking to organizations on these topics, he wanted to disrupt how we develop skills of people in healthcare. So in a Starbucks one day, the idea of app-based micro-learning was born. Now here we are. Now I pass it to Steve to take us through advancing patient experience in a world of team exhaustion. Steve, take it away.
Great, thank you, Matt, and certainly appreciate all of you being here. And I think as I reflect on life, in addition to being a husband for 28 years and a father of 2, I've sort of defined my purpose in life really twofold. That now I serve with an amazing team at my elbow, and that is, each and every care team member massively contributing to better care for patients. And impacting care in profound ways. And the second thing, doing that work in a way that brings enrichment, contentment, purpose. And all of us look over our shoulders at the end of our run, whenever that may be, and say, man, this is everything I hoped it to be. Because we know our industry is profoundly challenged right now. And the fact that you're here, we have so many people on the line. I think that you recognize the profound challenges of, things like the patient experience or any other organizational initiative that we have. It could be harm reduction, clinical variation reduction, bending the cost curve, or any of those things. requires discretionary effort and action from those interfacing directly with the patient. At a time when the fuel tank of that team that does the work at the motor end plate of healthcare is absolutely, utterly exhausted. And how do we do that? How do we access discretionary effort, and how do we help and support and lead organizations that mobilize people around a shared common purpose that fuels the reason for being in healthcare? And I think the most clear and obvious substrate for this is our connectivity to patients. And I have to tell you that there was a time during my clinical journey when I began this process of coaching, training, and developing clinicians, beginning with myself. What are the things that I do for patients that allows the patient to walk out and say, wow, you're awesome. Thank you so much for what you do and the difference that you made in my life. That connectivity to patients was the most powerful force in turning around how I saw medicine and how I experienced medicine, and the value that I saw even well beyond the ability to diagnose, treat, and cure disease, is that we have this profound ability, each and every patient, to make a meaningful impact at the scariest, most difficult times that patients experience. And what a gift and honor that is. And if you talk with physicians and nurses and APPs and staff members and leaders, they reflect on the most extraordinary times that they've had in this clinical walk. It is about their ability to make a meaningful difference and live the life that's deeply ground into why we joined this profession in the first place. So the process of executing against the patient experience, which is as important as it's ever been, and fueling the well-being of the team, we believe that threading that needle, they are right next to each other. So the effort that we're going to have in the three really domains that we want to focus on: number one, to really share some of the data in regards to the impact of patient connectivity and what it does to the personal experience of those providing care. And I can speak with great authority just on my personal journey, going from a pretty dark place to this is everything I hoped it to be, in that transition, not only of me, but the clinicians that we coach, train, and develop. When they become really good at what they do and patients provide them immediate feedback on making a difference, it's like, I am being the clinician that I've always aspired to be, and we're doing it together, and we're serving something bigger than each and every one of us. And I'm really proud of me and us and the journey that we're on. I mean, that's awesome. I mean, it feels really good to be a Golden State Warrior right now, to be a part of a champion culture that is doing extraordinary things, that's acknowledged internally and externally about the value that you bring. And so we're going to talk about that data. We're going to talk about three specific leader actions that are almost always overlooked by healthcare systems, and wondering how it is that we execute against the patient experience in a way that restores teams. And we give you three really powerful techniques to do that, and then provide you some resources to get rolling on that. But before we dive in, we're gonna get some diagnostic information. We're going to begin with some polls here. The first question is, how important is the patient experience effort relative to other priorities where you are right now? It's oscillating a little bit as we're focusing on other things. So we've got lots of responses coming in, and there's a clear winner that will that will show you. We've got a little bit of a bias collection based upon who's attending this roundtable. We got 3 seconds left. 3, 2, 1. Matt, let's reveal. All right, 58% said it's highly important. It is. It reflects everything that matters in healthcare is ultimately impacted by how it is and the signature that we have for each and every patient in every single encounter throughout the system that is consistent and reliable and scaled across everybody. So yes, it remains important. And let's take a look. We've got another poll here. The second poll that we'd like you to fill out here is, from your perspective, how do your care teams view the patient experience improvement efforts? As restorative, burdensome, or somewhere in between? There's also a clear winner here. All right. Yeah, we've got 120. Let's say 5 more seconds. 5, 4, 3, 2, 1. Reveal. So we're in a bit of a paradox, which is we've got a critically important initiative with massive downstream implications in terms of executing it or not. And leaders, those that are doing it, those that are leading it, those that are advocating for it, those that are ambassadors for it, those that are accountable for it, are seeing and hearing from their teams that this is burdensome. So what do we do? And so let's take a look. And if we look at, this is, I think this encapsulates what we see in the spirit of those that are providing care, including us. I mean, those that are leading care are looking at the circumstances and the voices and the cues and the experiences and the exhaustion and the stories of teams that are battling professionally and personally about the energy to do things. And we sometimes are having to, we feel like as leaders, we're on a stage, and if we're giving cues of exhaustion, despair, and even cynicism, that's a highly diffusible behavior. So we have to think about what is the pathway and what are the actions that we can take that allows us to execute an organizational outcome that is immensely important for all the right reasons, and to do so in a way that allows us to the teams to say, God, we're doing the right thing the right way. And I'm feeling good in each of my micro interactions throughout the course of a day with my teammates and my patients that are actually lifting me. So as we begin this process, this is a little bit about what we spoke about at our last roundtable. All engagement efforts, and engagement is, I'm going to stay here as a team member. I would advocate for this place to others who are thinking about joining a group or a system. I will access my discretionary effort to help this organization achieve. I will use my influence and my clinical microsystem to engage those around me. And this place where I am doing what I am right now is everything I hoped it to be. That's engagement, and we need engagement in any journey to create the behaviors that drive the outcomes. And the first step in any engagement endeavor is how it is that we lead. So this is not one of the 3 steps, but this is the soil that care team member participation is founded on. If the direct leader is not taking actions that render this voice from those that you lead, where I feel valued, appreciated, and I'm able to contribute, I feel safe here. I belong here. I see a future here. I have a chance to contribute, to put my eyes in, put my ideas in, and all of the things, all the leader skills that prompt people to actively engage. These are the sentiments and these are the experiences that are the byproduct of the servant leader skills that begin the process of participation. It is a dependency. And so as we think about how do we engage people to deploy effort in the context of profound exhaustion to execute something that is critically important to 58% of us and highly important to the rest of us, how do we do it? We begin by how it is that we interface with them. And every action that we take has to create a response where I feel valued and appreciated. I have a chance to contribute. I feel safe here. I am cared about by the people that lead me. I have a chance to grow and develop here. I see a future here. So this is not a leadership development course, but know that how it is that we interface with those that we lead is a dependency on their engagement and their journey ahead. Okay, so that's just a condition. All right. So some truths about the patient experience journey, the data behind it. And first of all, I love this picture. I'm a runner and a mountain biker, and it makes me want to jump on my computer screen and go. I don't know if you feel that way, but here's some of the data that empirically I have known based upon elbow to elbow with clinical colleagues for the last 20 years, and what the very best of medicine has to offer that rejuvenate us and create enthusiasm for the work that we do. But now we've got some pretty solid data to verify that. This is a surveying about 500 physicians, APPs, and leaders across the country pre-pandemic. And what we found is those clinicians who describe the environment where they are as authentically, legitimately, witnessably committed to what's best and right for patients, the probability of them expressing burnout behaviors was 4x less than those clinicians who described their existence as a revenue center. So the notion of building a purpose-driven organizational priority and objective and simple rule and guiding light and North Star is going to be about connecting and resonating with the value systems of those providing care and compelling evidence that that reduces the sense of exhaustion and cynicism, depersonalization that characterize burnout. And again, others have validated this. And I think this is the same for nursing. I mean, the best thing is what we do is our ability to treat and interact and help patients. Again, it's that micro interaction, and doing it extraordinarily well gives a feedback loop, which is affirmation that we are making a difference in this clinical life. And we desperately need that. I mean, with all the sacrifice that we've had to get here and all the work of medicine weighing on our shoulders, to get the feedback of I am making a difference by virtue of the feedback that I received from a patient and a family is a necessity in the durability in this very hard profession. This is a study that we had done with Northwell Health using clinician microlearning. And the intent was to demonstrate that coaching and training clinicians using technology-powered microlearning drives patient experience with a control group and intervention group. And we found that as the primary outcome was patient experience, and found all domain improvement. And the secondary outcome was Maslow and burnout reduction. And we found even greater impact on sense of accomplishment, sense of purpose, sense of pride in who we are and what we do, which is exactly what we had been observing all along, that the coaching, training, and development and deployment of simple behaviors to engage and connect with patients was even more impactful on those that are providing care. This is Ohio Health, who had taken their hospitalist division, and they bound together on their CPX journey, which is focusing on the well-being of the physicians and APPs and in connecting to patients. Their results in this journey of using skill building to allow that to manifest had profound impact on how patients saw care. But in the entire system, that cohort that was on this mastery journey to become better for the patients that we serve had the lowest level of burnout throughout the entire system, which is exactly the logic and rationale for how do we leverage an intelligent pathway to frame, position, and execute a patient experience journey so it can tap the benefits. So clinicians say, this is the best thing we've ever done. Finally, we're doing something that is profoundly important and deeply impactful for me and the patients that we take care of. Cleveland Clinic, same thing. They coached about 1,500 clinicians, and they had an intervention arm and a control arm, and they found all domain improvement on patient experience. And they also found significant reduction of burnout-related symptoms in accordance with deeper connectivity to patients. So, and again, there's additional studies, but if you question this, saying we see this as burdensome, this is not something we could possibly, in the context of all the priorities that we're faced with right now, how could we give this to clinicians too? How could we not? This is the best of what medicine has to offer. It's the most restorative, rejuvenating, exciting, restorative experience we have as clinicians. And if you ever have a moment of doubt, try this exercise where if you've got a group of clinicians, again, nurses, APPs, physicians, whoever it may be, and have them reflect for just a moment, their best moment that they remember as being a clinician. You know, what was it? The thing that's etched in their memory as their best moment. And I've had a chance to do this with thousands of clinicians over the last 20 years. And you allow them to go around the room and tell their story. And it's extraordinary, the stories that clinicians remember. Sometimes it's last week, sometimes it was during residency, but it's rarely about a clinical sequelae. It is about a relationship and impact and making a meaningful difference in the lives of patients and being the clinician that they always aspired to be, and to drive home incredibly proud of who they are. And for us to deny that opportunity, as we say, no, this is burdensome. It's not burdensome. It allows us to be who we have always wanted to be. We have to leverage our leadership to get rid of the crap of medicine and deburden, appreciate, get burden out of the way, to listen and respond and to empower. Yes, we have to use our leadership to allow the patient connectivity to be unleashed. That's effective leadership, is the overarching, again, soil that allows these three strategies to manifest. So some of the things that are known to stifle patient experience that we see not uncommonly and often not intentionally. I mean, nobody's rolling out a patient experience strategy to say, I want to goof this up, make this a burden, make this an initiative, and overwhelm our currently overwhelmed workforce. Nobody's doing that. But thinking that a compelling speech from a C-suite, how important this is, that it's going to cascade through every layer of leadership, so it's framed and positioned in a way to empower the people to take action as they have the micro interaction with patients, it doesn't work. They set the vision, they create a cascading mechanism, and they will sponsor solutions. Absolutely, they have a key role in the journey, but that alone, that a la carte intervention, is insufficient. Proceeding with improvement efforts without first establishing who it is that we're going to be. For those clinicians in the room, this is the preload. This is pulling back the slingshot in any organizational change effort. To have a clear future state of what we aspire to be, that is created by the team and deeply connects with everything they hope for an irresistible future state. Imagine if, and what that's like, and having this clear sense of what our purpose is. And what our purpose is the context by which all tactics and strategies live. It's the context of all other actions and operations. And without that housing, without that cloak of kindness and compassion for every colleague, every teammate, and every patient, that's who we are. Without that, and you start rolling out tactics, it is burdensome. In fact, it's irritating. So this is the house that we build. We convey a purpose that is deeply connecting with why we are in this profession. We somehow unintentionally make it about a metric. Metrics are the currency of the world. We get it. If we are doing actions in the exam room that are evidence derived to change how patients see care, you will move the metrics in radical ways. Radical ways. I can tell you that we went bottom decile, top decile. I achieved the 99th percentile for a decade straight personally by doing super simple things in the exam room. But if we somehow make it about a metric, you will disengage the care team from the commitment to take action to achieve the metric. It's a paradox. So we don't cloak this ever as a metric. The metric is always the child of your purpose. It is a quantitative proof of your purpose. So once that purpose is understood, embraced, and co-created, this is who we are. This is who we aspire to be. The next question is, how do we track it? Because we have to track it. We can't just say, look how awesome we are. We have to quantitatively track our progress over time. Providing data without the tools to improve. I've never met a clinician ever who could articulate why patients say what they say about them. I can assure you, they don't know. So giving data without tools is cruel and highly ineffective in the journey of advancing patient connectivity. Failing to include physicians in the journey. Physicians have particularly ambulatory environment, have profound impact on how their team sees what we're supposed to do and how we do our work, and the diffusion from the C-suite to that small group of people must be amplified by every layer of leadership and ultimately handed to the physician and the nurses in the inpatient environment. We have to become advocates and ambassadors, teachers, and to model that behavior for that to be able to embrace the people at our elbow. And also framing the context that this is just about the patients. This is about having a purpose-driven life, is what this is. This is about being who we aspire to be, again, to see and feel the difference that we're making. And the data suggests that deploying actions that engage and connect with patients is powerful for the patients, no doubt. It's even more powerful to us. So to summarize sort of our introductory thoughts in regards to sort of laying the foundation and understanding that patient connectivity can help and restore care teams. There's, again, compelling qualitative and quantitative data demonstrating patient connection and impact can fuel team contentment, sense of accomplishment, and purpose. It is the best of medicine. And to say we're going to pull back on this because we have other things to do is losing an opportunity to help lift the team and the best of what this profession has to offer. Secondly, this is our value system. This is not an initiative. This is simply what it means to be a part of a healing profession. We are about impacting the lives of those that we serve, including our colleagues. And how we lead this effort, how we frame it, introduce it, support it, communicate it, will 100% predict your success. Like anything else, how something is led will predict whether it takes flight, delivers results, and creates compelling cultural change where the members of the team say, again, this is the best thing we've ever embraced. And we're immensely proud of who we've become. And we're doing what's right. And we're doing it right. So to do that, we got to learn how to lead it, right? So anyway, that's I hopefully provide a little bit of context in regards to the evidence behind and the support of connecting to patients, lifting care teams, and the power of effective servant leadership, where teams say, man, I feel heard, I feel valued, I feel supported, my burden is lifted, they're rounding on me, they're giving me cues and signals that I belong here, I am safe here, they're giving me resources to raise my hand for help. All of those are conditional elements, dependencies for care team members to get out of survival mode, to actively begin to go down the road of serving patients in a way that allows them to be lifted in this journey. So 3 specific actions that we can do. And the first is going to be pretty disruptive, okay? And you're going to look at it and go, oh yeah, that makes sense. But I'm going to challenge you with how this can really manifest, okay? So step number 1 is building a local cause. Again, how do we transition from our big rock priority is patient experience as manifested by the 85th percentile by the end of 2023? Whatever, who cares, right? But how do we cascade that in a way that allows people to deploy discretionary effort in a way that fuels their sense of pride, unity, and accomplishment? Because it is not how hard we work, it is the conditions that we work under. And the power and the impact of that, written by Viktor Frankl, who, if you don't know, is a survivor of Auschwitz. So, finding meaning and purpose, we have such profound accessibility for who we are as we show up in an exam room to be the clinician that we've always aspired to be. And so the condition that allows us to engage is to create a local cause. So first of all, what is a cause? Okay. A cause is a principle or aim because of a deep commitment one is prepared to act on, defend, or advocate. right? That's what our team members, and certainly our clinical microsystem team leaders, are influencers that are peppered throughout the front line of healthcare. They have to be embracing a cause, okay? And what gets people to embrace a cause is not what the CEO says. It's the question, what does our team want to become? To give you an example, and this is one of the most untold stories in all of healthcare, but this is super important. And it reflects, and we didn't do it, and we weren't smart enough at the beginning of the Sharp experience to do this intentionally, but it happened, and it reflects the power of local empowerment to craft a local cause, to create engagement and participation to get something done. So the beginning of the Sharp experience, which was around 2000, I got involved around 2001. There was a lot of activity happening. There was a big marketing campaign, incredible commercials. There was a lot of staff training that was happening on the fundamentals of consumer experience. And we weren't getting much traction, and there was a lot of eye rolling and that sort of thing. So our GI team, gastroenterology, was aware of the Sharp experience and what we were trying to do and become and achieve. And everybody was going, wait, yeah, that sounds compelling. So the GI team took it upon themselves, after knowing the global mission of the Sharp experience, which was to transform the patient experience. They decided to create, at the endoscopy suite, the concierge colonoscopy. I mean, it was awesome. They had tuxedos, scrubs that were tuxedos. They had white towels. They had silver platters, and it was this incredible collaborative, independent, local effort that was under the umbrella of, we want to transform the experience of those we provide care to. And their patient experience shot through the roof. Actually, a local news station had done a story on them. And they were interviewing patients about how amazing this terrible day was, given the unity and the pride of the team doing a concierge colonoscopy. They ended up winning an award. Their award was presented at one of our our clinician meetings. And their urgent care team was there. And they thought to themselves, we can do something like that. And they began to communicate this locally created actions of who do we aspire to be, empowered at the local environment, that brought our urgent care network from single percentiles, literally first and second percentile, to one of the highest performing urgent care networks in the nation. They were touring the country regarding how it is that they transform urgent care delivery. And we would like to say we empowered teams under the guiding banner of kindness and compassion for every patient, and to power you to think of your own self-determination effort to create solutions that are uniquely yours, but it just happened by accident. But it's one of the most powerful ways to empower people to embrace the cause, by giving them the authority to innovate what makes sense for them. So creating a cause, though the patient experience is often a global effort, meaning we want this to happen everywhere, it often manifests locally, meaning what are we going to become? What does it mean to be us? A local cause crafted by a team, a local leader, even down to a clinical microsystem for people. What do we aspire to be? It creates unity, pride, clarity, identity, ownership, and innovation. I can assure you that people at the front line, thinking on their own underneath the umbrella of kindness and compassion for every patient, will think of things that you will have never thought of. And it is entirely different to think of something and to do something based upon what we aspire to be than to hear the voice of your executive team telling you what to do. So local leaders must facilitate the question, who do we aspire to be for each other and our patients? And I would encourage you, and what you decide to innovate around is really up to you. And if you find we couldn't, the burden quotient is so high that maybe we just say, what are we going to be for each other? And allow them to innovate around that idea. What you decide to pursue and create is up to you. But who will we be for each other is remarkably restorative in terms of building a sense of team, collaboration, partnership there for each other. I'm gonna ask my LVN twice a day what I can do to help make his or her work easier. I mean, whatever it may be, it's incredibly powerful to co-create our destiny together where all team members are participating. Because ultimately our outcomes are driven by our identity. Who do we aspire to be? And utilizing outcomes as logic and rationale for what you want people to do, that makes as much sense as you need to lose 15 pounds. Well, that's an outcomes-based rationale to patients on what they should do. It has no influence on behavior. And you can toggle it down another layer and say, you need to lose weight, you need to exercise and eat less. Well, that's a behavioral level intervention that has slightly more impact, but not much more impact on the probability of engaging behaviors to drive an outcome. What fundamentally drives human behavioral change is, what does it mean to be me? Who do I want to be in this walk? Who do we want to be? What does it mean to be us? And our ability for local managers to run activities to identify your story for what it means to be us and fuel your identity. Once your identity is determined, that creating a local cause, then the behaviors will emerge from that. We, practicing excellence, come in at that level. We help you and support to form identity, but we have to build skills and take action that are a manifestation of that identity. Because every time we do a behavior that is an expression of our identity, it reinforces our identity. It's a positive catalytic loop. Meaning if kindness and compassion is who we aspire to be, and we provision kindness in the exam room by deploying certain skills, patients will give us feedback and it affirms this is who we are. And that in turn drives outcomes. So how do we run this exercise? So this is a 7-minute drill on how is it that we create meaningful, compelling story. This is from Liberating Structures on how to get people to collide with each other. And this is your team. It can be family medicine. It can be your clinical microsystem. It can be a department. But I encourage multiple disciplines. And you run it in 7 minutes, okay? And you ask the question, if we become everything you hope for as a team, us together, for our patients, and for our patients, what does that look like? Or maybe it's just for your team and for each other. What you pursue is less important than the team crafting what it is that they want to become. For 1 minute, allow each team member to think on their own and to write down, what do we want to be for each other? What do we want to be for our patients? Imagine if. 1 minute. And then after 1 minute, you call time, then 2 people exchange ideas and share their stories. So a PSR is talking with a physician, APP is talking with a LVN, and we're exchanging stories in regards to what do we want to be for each other. And then after 2 minutes, 2 people talking, you call time again, and groups of 4 exchange your ideas for 4 minutes. And then you debrief and you scribe your crowdsourced story. This is who we are. So our ability to empower local teams to actively contribute to what they want to become is a predictor of participation, engagement, voice, autonomy, innovation, all the things that deburden the prospect of pursuing the patient experience, because we wrote it. It already deeply syncs with why we're in this profession, but the fact that I wrote it, way better. And why a cause is essential. It is the room where skill building and data live. Kindness and compassion for every patient and every teammate. That is our house. And in that house, there is a room called skill building. There is a room called data. Without that house, then skill building and data get really vulnerable as highly burdensome. And so infrequently we skip the process of creating a cause and a purpose that's what we got to do. So, and it provides an opportunity to be able to harvest solutions and spread the seeds across the organizations and celebrate progress by the incredible innovations that your team will invariably come up with. And so leaders become conductors of an orchestra as opposed to micromanagers and suppressing of ideas. So skill number 2, okay, is we build skills. And Gallup and others, and I can tell you, and those of you that have been recipients of investment to help and support you become your best, Gallup has shown it is the most powerful driver of engagement. It is a signal you matter, you count. We're here to help you do the things that you are so deeply connected to. So building a learning organization that is continuously improving and helping and supporting their teams to not only better connect with their patients, but to collaborate with one another and to lead, to lift others, to take care of self. Oh, we can't leave that stuff to chance. You know, clinicians are local clinical microsystem team leaders. Are they able to leverage their influence to engage the people that look to them for leadership? I don't know. We got to build that skill so we know that happens. And learning continuously is an incredibly powerful effort. So a couple of polls here real quickly. Matt, let's pull up the next one. Your question is, we report PX data to clinicians. There's a big winner on this one. 3 more seconds. 1, 2, 3. All right. There we go. Okay. 90%. Okay. All right. So let's take a look at the next one. The next poll is, do your clinicians have tools to help them improve patient experience measures? Awesome tools, decent tools, minimal tools, no tools. I don't know. So excellent. All right. Okay. Excellent. 5 more seconds. 5, 4, 3, 2, 1. Reveal. There we go. Some opportunities here. So again, having dedicated my life to helping and supporting clinicians, nurses, physicians, APPs are unbelievable students. Unbelievable students. And it's not for remediation. The best of students are the ones that say, I would like some help on becoming better. That's a highly coachable clinician. So what does learning look like? So there's a notion that we call learn, try, share. The majority of what's ever learned is never used. That's not helpful. So if we look at what do people remember? What do people, what are the methods that create neural pathways to create human behavioral change? So they read, hear, see and hear, say and write, and categorically what they do. So creating a process that allows people to do and take action is a vital element as you architect a skill building apparatus that fills the house of kindness and compassion for each other and our patients. Boom, simple rule. That's our declaration, our North Star. And we're going to have innovations, empowering local teams to develop tactics to allow that to manifest, that we will spread everywhere. But we have to develop a skill building strategy to allow those actions for each other and with patients to manifest. And if you look at what patients seek, I mean, if we're doing this because we want to keep patients in network, that we want to have patients become our ambassadors out in the marketplace so we compete with emerging retail competition and reduce our patient churn, or whatever your markers of we are doing this right, there's a financial imperative for this, but this is what the patients are looking for. So as you look at each one of these, you say, are we doing evidence-derived actions to make sure this is the sentiment of your patients? Most of us would say, I hope so. I don't know. Having been behind the exam room door, I can assure you, with really good groups and super smart clinicians, the variance around the actions to make these sentiments apparent for patients puts clinical variation to shame. It is all over the place. So having evidence-derived simple actions that clinicians, nurses, physicians, APPs, staff members, leaders can do to advance the patient connectivity is a vital part of the strategy to fill the room of kindness and compassion to every patient. And we're on a mastery journey that helps us become really good in that endeavor as we build the skills. As we build the skills, these are just one panel of skills. And if you look at simple things like conveying compassion to patients, we as clinicians miss 90% of all empathic opportunities when patients express fear, worry, concern. We don't even respond at all 90% of the time. We interrupt patients after 11 seconds. 5% of us in a study that was published in 2018, where patients feel like they're active participants in care. I mean, I don't want to say we're not good at this, but we never learned it. So for us to manifest it, building the skills clinician to clinician on what works is vital. It is a fundamental element of predicting your ability to get there. What we've learned and sort of pooling how it is that we do our work, making lots of mistakes along the way, is we have to make it quick. Clinicians say, I don't have any time. I don't have any time. So we've built a model around 5 minutes a week, make it work, have it come from the evidence. We have to make it actionable. What is something I can do with my next patient? Boom, right away. Make it scalable. The power of everybody going at the same time with the same source code is incredibly powerful, and allow the skill building and coaching to map to organizational priorities. So if you say patient experience is your big rock, then part of your catalyst to get that is to build the skills across the enterprise to allow that to manifest. So in addition to building the purpose and framing it and empowering to the local front line to engage people in the journey ahead. A little bit of our data, we've got 13 case studies. There's no question the coaching, training, and developing clinicians, care team members, managers, the entire spectrum of the care team benefit from coaching, training, and development. Some of the big drivers of learning accelerants. Number one, leaders are actively engaging in the learning process in a highly witnessable way, because we don't want to delegate learning. Go, you doctors, nurses, APPs, and frontline people, go learn things, and why go do important leader things over here? I'm going to assign this to you. No, we're all doing this. We're all learning skills to advance our mission to execute our big rock priority. And I'm learning in witnessable ways, me then thee. Learning occurs individually, meaning people have different individual needs and they have the ability to learn together because people learn in different ways. It's framed as a manifestation of our shared purpose. Our purpose is kindness and compassion for every patient. It is in that house. It is the child of our purpose. We set up a certification process where clinicians can get certified in patient connectivity, nurses can get certified in patient connectivity, leaders can get certified in leading the patient experience, whatever it may be, and building it into your performance management. You get 100% engagement. And again, these are your operational decisions, but what some of our most compelling members have done and been, and we become a storytelling organization. The things that happen as a result of care team members deploying skills is breathtaking. And so as we build skills and execute our mission of advancing patient connectivity by empowering who is it that we aspire to be, by empowering team members to craft their own story under the guidance of our simple rule of kindness and compassion, and we begin to deploy a skill building journey a few minutes a week that is done synchronously, we begin to celebrate the progress. Celebrating the progress and telling the stories of what happens. The story of a surgeon standing up and learning how the power of recognizing somebody else and having a life-changing moment, that recognizing a teammate is the most powerful mechanism to engage others, to appreciate others, to build a collaborative culture, to create approachability and to create a sense of I'm making a difference for my teammates, for my nurses and my patients is by taking a moment to thank and recognize them. That is a skill. And to be able to have that surgeon stand up and tell their story and to say, we have got to be able to tell the story of and recognize and thank the people that we work beside. The observations of storied progress, stories told of skills applied will be replicated and spread. Part of the mastery journey, and certainly as part of the practicing excellence MO, is not only deploying skills across the clinical enterprise with a shared program that maps to organizational priorities. It is mostly about harvesting the stories and having clinicians, nurses tell the story of what happened when, to invite others to give it a go. And they always have a story to tell. When you say to a patient, what about all that you're going through right now worries you the most? Having them stand up and share what they discovered, it's like, God, I'm going to do that too. That's a lot better than putting dashboards in a meeting, but having people tell the stories of skills that they applied and what it meant to them and the patient, and to use that as a contagion mechanism for others to embrace it and spread it, providing an opportunity for this is what happened, creates an organic diffusion of skills in the spirit of see one, do one, teach one for you clinicians in the room. All members working on the same skill significantly accelerates improvement. We have found this synchronicity of people working on the same thing at the same time when there's complex organizational misdirection, being able to have, we are working on patient experience and we're all having access to it at the same moment, at the same time. And again, keys to coaching. This is those that are interfacing with either teams or individuals. And this is a reflection of sort of how I coach clinicians. It's simply asking people, tell me about who you want to be. Who do you want to be in this life, in your professional life, and your personal life for that matter? And then give them something to try that is a manifestation of who they aspire to be. And when they go through that toll booth of, I tried something and I saw a profound impact with my colleague, with my teammate, with my patient, they say, I'm going to continue to do that because that made an incredible difference. And then they stand up and they begin to evangelize about the stories that they saw. And we inoculate the organization with the same tips at the same time via text, via app, but we create contagion through storytelling. And one of the things that is our most passionate body of work is how leaders lead the patient experience. How do we do this? Because how is it that something that is so beautiful, so sacred, so impactful, so important, so restorative is seen by almost everybody as a burden and an initiative? We've screwed something up somewhere. It's how we frame it. So we've built this program to certify leaders on how do we create a cause? How do we communicate the future that pulls people in to say, to make it irresistible? That is what we want to be for each other. That is what we aspire to be for our patients. That syncs with why I joined this profession in the first place. How do we track and use data and story in a super adaptive fashion? And how do we build skills to build a continuously improving learning culture where we never stop? And it's designed for anybody who is a ambassador, if you will, and leader of this effort. So in summary, as we close, willingness to participate in an admittedly exhausting time, and sometimes very dark time, is a function of how leaders lead. That's how we lead. And building our skills to lead with growth mindset and team intelligence and gratitude and appreciation and multiplying leadership and all the things that prompt people to have those sentiments of I feel valued and heard and cared about, that can profoundly impact the sentiment of our teams. And it's really energizing to lift people and watch them soar. Connection fuels restoration in very powerful ways. We often botch the potential of an effective patient connection effort in exchange for a top-down patient experience initiative that can turn the effort to a burden. I mean, we do it every day, and it's not mean-spirited. It's not intentional. It's just that we haven't framed it in a way that engages people to actively own it, participate it, and author it, and become it through continuous learning. Leaders must facilitate local shared purpose, systemic skill development, application, and tracking progress through story and data. And the mastery journey never ends. And it can certainly apply to patient connection, leadership, well-being, team collaboration, telehealth, or anything else you want to get good at. We can't expect to execute it without the behaviors, skills, and competencies in place to make the future state manifest. So with that, we are immensely grateful for your being here. Hopefully this was helpful for you. And I will pass back to Matt. We will hopefully be able to field a few questions with some resources that will be coming your way. So Matt, passing back to you.
Thanks so much, Steve. So just want to let you know that, again, we're here for you after this event is over. We'll be sharing the slides and a link to the recording in case you want to share it around with some of your colleagues. Next week, you will receive a document that summarizes the key points of the webinar, our poll data, and includes those how-tos that Steve shared within each step. Hopefully those will be helpful tools. And hopefully, please save the date for our next webinar on the 28th of July at the same time. With that, I would love to see if there's some Q&A coming through. I think there is. One of the first questions I saw, and I'm paraphrasing here a little bit, Steve, if you could just jump to the next slide quickly, Steve.
Oh, sorry.
No problem. By the way, this is how you can connect with Steve, kind of one-to-one, share contact information, start a conversation with Steve. There's a link to his ebook. And again, just reminders on what comes next. So one question I'm paraphrasing here, Steve, is why do we need to coach everyone together? Why don't we just focus on the low performers? What's the importance? Why is it so important everyone go together?
Yeah, so it's a great question. The learning literature is now compelling that there's really two things that accelerate skill adoption, use, and application. Number one is coachability, meaning I realize that I'm doing something that I could do better and I'm interested in learning more. Versus somebody's making me get coached because I've got a red light flashing on my dashboard. We have found through some work with a group that we've worked with is that those clinicians who raised their hand, their delta in response to coaching intervention was 3x higher than those that were coached in remediation. So, and we found that the coaching intervention was actually higher in terms of yield and benefit over the middle band than it was the lowest band. The second is that learning is a group endeavor. It's exchanging stories, exchanging ideas, solving challenges together, and to feel like I'm not alone in this walk. And the patient experience, as well as team collaboration, as well as leadership effectiveness, it's just far more impactful to be with a tribe that is learning it together and helping and supporting and mentoring and challenging and sometimes calling each other out together than it is to be in isolation. So we've tapped sort of the power of going together, but there's still benefit of learning on your own and learning together, because learning comes in all sorts of different channels.
Excellent. We're at the bottom of the hour. Thank you, everyone, for being here. We will follow up with those who ask questions so we don't have time to answer. Have a great rest of your week.
All right. Thank you, everybody, for being here. Take care.